It's a result of what?
The heart fails, so everything gets backed up and congested.
Absolutely, right? So it is a consequence of a lot of congenital heart disorders as well as acquired cardiac disorders, right? So congenital and acquired. And it's just a consequence that they get. As the heart is pumping and very ineffectively, it starts to fail, and then things just kind of start to back up, right? So if they've got right-sided heart failure, we're gonna see it where? All over, right? In their extremities, right? They're gonna be very noticed all over. If it's left-sided, in their lungs, right? Okay. So our goals for heart failure are to make sure that we're promoting oxygenation, right? And promoting cardiac function, right? So if it's if their heart is ineffectively pumping, what are we going to do for them? We're going to give them some medication, right? We're going to give them like DIG or something like that, right? Do we want to improve the contractility of the heart, right? Give them some DIG, okay? And make sure that we're providing appropriate nutrition in a way that is going to support their disease process, right? So maybe they fatigue out during a really big meal, so we might have to break those down into smaller, more frequent meals, right? So they don't get as fatigued while they're trying to eat, right? Fatigued versus bored. You're gonna see it. Like when they're bored, I mean, they're kind of irritated that they're bored, right? Like, and they tell you over and over, I'm bored. But when they're fatigued, like you can see it. Like, when they get up and like maybe walk from their bedroom to the kitchen, like they're a little bit slower. They might like see that they're breathing a little bit harder because they're having to exert a little bit more to get there because they're eating. But they're just kind of slow with it. I know it's really hard. I know. You're like really. You're like yes. It will be very obvious that they're becoming fatigued. Their breathing will change, right? So if they're like trying to eat, they're becoming fatigued. They might start breathing a little bit harder, a little bit deeper, because they're having to. They're expending more oxygen than what they have, right? When they're trying to chew and swallow and all of that. They're just using a little bit more. So it'll be pretty obvious that they're fatigued versus just bored. Right. All right. So those are our congenital defects. How do you feel about those?
Pretty good.
Pretty good? They're pretty straightforward-ish, right? Okay. Now we're going to talk about, and then heart failure was an acquired one, right? That we talked about briefly. You've all learned about heart failure before, right? Take that and now apply all of those developmental things that you learned from week 1 to heart failure in a kid, right? We're still going to be doing a lot of the same things, but your approach to some of those things might be a little different, right? Based on their developmental level, okay? All right, the other two big ones that we're going to talk about as an acquired cardiovascular disease is acute rheumatic fever and Kawasaki's. Acute rheumatic fever is the result of what? Strep infection, right? What about Kawasaki's?
I know, right?
It's idiopathic. We don't know, right? It could be autoimmune, right? We don't know the cause. We think it's some sort of viral process that they maybe had that then sends the body into kind of this autoimmune response where it attacks itself, right?
I like Amber, right?
Not quite like that. This really primarily just attacks the capillaries everywhere, head to toe.
Is it short term or then their capillaries are like that forever?
No, they will recover. So there's an acute period that lasts about 10 days-ish, where they're gonna have like peelings of their hands and their feet. They're Like their tongue is bright red, right? That strawberry tongue. Their eyes look bloodshot. Their head to toe looks like they've got a massive rash, but it's really just the capillaries leaking that are inflamed. And then from mouth to anus, they're gonna have sores. It's gonna be very, very painful. So we're gonna see that we might have to put down an NG tube to feed them, because it's gonna be very painful for them to eat and swallow. It's also gonna be very painful for them to go to the bathroom. So we might have to put in a Foley, and then they're gonna be on a lot of like stool softeners and stuff like that to make sure that their stools are nice and soft. Okay, but we'll get into that one a little bit more as we get to that one. Okay. So, acute rheumatic fever is an inflammatory disease that develops as a result of an untreated strep infection, right? Most commonly, it is strep throat, right? But anywhere in the body where they could get a strep infection, this could be a result of, right? But most commonly, it's after an untreated strep infection, strep throat, okay? It affects the heart, the joints, the brain, the skin. It's really important to diagnose and treat strep throat early so that we can prevent acute rheumatic fever.
Is it always like if you don't treat strep throat, it will turn into that, or
Not always.
will strep throat go away on its own at all?
It could go away on its own. Some don't have any lasting effects, but if it did turn into this, it can happen. It doesn't happen to everyone. Yeah. And then because it affects the heart, this is why it becomes an acquired heart disease issue, right? So you've got your cycle there, right? So you first have inflammation that occurs in the heart and the joints, so it's causing like endocarditis, right? That infectious process in there. You got your strep throat that is untreated, and then it leads to damage, and it causes permanent heart damage, right? The damage is still there. However, symptoms can improve over time, but the damage remains, right? So we know that once cardiac tissue is damaged, it remains damaged, right? We can improve some of the symptoms that they're having, but that damage is always going to be there, right? Okay. So when diagnosing rheumatic fever, it breaks it down into two categories. You got your major criteria and minor criteria. So these are all the things that the child could present with. If they have if they've got two of the major criteria, they can automatically diagnose it as rheumatic fever. If they've got one major plus two minor, automatically they will diagnose it as rheumatic fever, right? I'm not going to test you on this piece. Okay, so you don't need to know the classifications, right? So, how are we going to treat it? Really, it's treating that underlying strep infection. We want that treated first, and then it, depending on what damage it caused, it's symptomatic treatment from there. Right? But really, the upfront thing is making sure that any signs of strep throat that you see, immediately you want to get that child in and get them tested for that and get them treated. Okay? All right. So we talked about Kawasaki's already, right? A little bit. This is just kind of an autoimmune response that affects the capillaries, right? So they're going to be bright red everywhere, just like we talked about. Okay. They will present with a fever, a high fever for 5 days that is unresponsive to antibiotics. Okay. They're going to present with a lot of irritability, rashes, lymphedema. So very distinct rashes. So again, this is going to be that strawberry tongue, right? Have you heard that term before, that strawberry tongue? Okay. And palmar erythema. So their hands, specifically the palms of their hands, are going to be bright red. And then they're going to have desquamation. And that is the peeling of the palms of their hands and their feet. Okay. They can also have that peeling around the perineum, in between like their fingers and their toes. It is very, very painful. Okay.
Why does that happen?
Just with that inflammation process, it's just irritating all of those areas, and it causes this to happen. I will tell you that this term is not in the dictionary. This is not in the dictionary. You will not find this in the dictionary.
Like it's not a real word?
It is a real word. It is a medical term that is not in the dictionary.
Not in like a normal dictionary?
The dictionary that we have available for the tests. Yeah, you know those dictionaries that we have available during testing? This term is not in that dictionary, right? I can't tell you how many times I have said that, and I still see a student go grab the dictionary and then they huff when they can't find it. I know exactly what question they're on when they get frustrated that they go to the dictionary and can't find it, right? So this is not in the dictionary. But just know that that desquamation is that peeling of the hands and the feet.
I mean, it makes sense. D, this, like the squamous stuff.
Mm-hmm. Yes. If you break it down, it makes sense. So just know that that is not in the dictionary. Okay. Okay. The reason that this is an acquired cardiac disorder is because it causes significant damage to the coronary arteries, right, and the capillaries that feed the blood supply to the heart. Okay. Early diagnosis is very important, and treatment is very key. So this is where we will see they will have four daily doses of high dose aspirin, and then they will be on low dose lifelong. Okay, so they will have the high dose aspirin followed by low dose long term. Okay, the other thing that we're going to give them is IVIG. Okay, we don't know what's causing it, but we're just going to give them a whole bag of IVIG to help boost their immune system to fight this process. We know that the IVIG, in combination with the aspirin, works really well if given within the first 7 days of diagnosis of Kawasaki's. Okay.
This is the only one that we give aspirin to?
This is the only one that we give aspirin to, right? Otherwise, we don't want to give aspirin to kids because of the risk of Rye syndrome, right? However, through like all of the medical testing and research that they've done, they know that the risk benefit to treating Kawasaki's with that high dose aspirin followed by the long-term low dose and then IVIG, the benefits outweigh the risk of them having Rye syndrome after the administration of the aspirin. We know that this combo, the IVIG and the high dose aspirin, works really, really well in effectively treating Kawasaki's. I have only seen this one time in my career, 11 years of being a pediatric nurse. And every time I go through this lecture and I'm like, you're never gonna see it. It's so rare. And the last time I was at PCH with a transition of practice group, one of my previous students was like, hey, remember in cardiac when you said we're never gonna see this? He's like, I've had like 5 patients already with it. Okay, I have worked in smaller hospitals, one rural hospital, and then I work at Banner Thunderbird on the west side, which isn't super small, right? But our like Peds unit is small. So typically those like higher risk things go to PCH. Just because they have more specialists on hand than we do, so they will see them more often there than we will. Okay. So monitoring long-term coronary arteries, right? We want to make sure that we're continuing to monitor the heart lifelong after they've been diagnosed with this. Okay. Okay. How do you feel about all that? That's a lot. We went over 7 disorders. 8. 8. 8. We went over 8. Right? It's not nearly as crazy as Module 1.
Yeah.
Right? This is in one chapter. Okay, we are not done, so don't go. Okay? Before we move on, do you have any questions about anything that we went over? Anything you want me to clarify? Brittany, did you raise your hand?
Yeah.
We got a list.
Oh, boy. She's over there just writing a list of everything.
Number 1.
For tetralogy of valid, it said in here that we were gonna give them 100% oxygen or do a blow-by. What's the blow-by?
So blow-by is where we hook up the oxygen into kind of a bigger tube and just kind of like position it near their face. It's not nearly as accurate as actually like applying the mask or applying a nasal cannula. So if they're absolutely not tolerating the cannula or the face mask, you can just kind of do that blow-by where it's kind of like that accordion tube, right? Like that thicker tube, where you're just gonna hook up the oxygen supply to that and just kind of position it near their face. So it's kind of hopefully forcing them to get a little bit, but you can't really chart how much oxygen they're getting because you really don't know because it's just kind of blow by.
Module 1 is gonna be in the exam, correct? Just confirming.
1, 2, and 3.
I do have a question. How deep are we going into the motor skills based on age?
Not super in depth.
Thank you.
Oh, I have a question. So like if it comes picking between the two, do we pick the lower? Is it more efficient if you pick the lower age and the higher age if you come between the ages?
What do you mean?
Like if it's not the exact age that it says on the thing, should you go up or down?
It will be so far abnormal that
So not like the quiz.
Okay, well, vitals, right?
What do you mean not like the quiz? The quiz was very straightforward.
What are the statistics of the test? We need to read every single word.
Yes.
Can you tell us a 6, 7 statistics of the exam?
It's usually pretty good.
Pretty good?
Yeah.
Students typically get 6 to 7.
They usually get about a